Hello and welcome. Thank you for joining us today, whether you're in person, virtually through our Zoom, or Facebook Live. We are really looking forward to our conversation today. My name is Omar Rodriguez. I'm here on behalf of the Sí Se Puede Collective, School of Arts and Culture at Mexican Heritage Plaza. I will be your moderator for today's conversation. Si prefiere escuchar la conversación en español, favor de conectarse vía Zoom. Nuestro equipo pondrá los enlaces en el Facebook de la colectiva Sí Se Puede. Within Mayfair and East San Jose, community-based teams of the Sí Se Puede Collective, the co-ops De Colores Consulting, and Meta LLC groups are hearing a lot of questions and growing concerns regarding the vaccination of children. As a result, the Sí Se Puede Collective, in partnership with Gardner Health Services, has come together to host this town hall meeting to discuss the FDA authorization of the Pfizer COVID-19 vaccine for emergency use in children ages 5 to 11. Again, thank you for joining us this evening, and I'd like to move quickly to introduce our panelists today joining us. Thank you, ladies. First, we have Dr. Ranjani Chandramouli. Hopefully I pronounced that okay, doctor. She's the Gardner Health Services Medical Director, and she will be leading our conversation and also grounding us in the topic of today. Second, we have further down, Jacqueline Franco, who is a mother, business owner, and partner of the East San Jose Peace Leadership Team, and has been on the grounds connecting with families throughout the entire pandemic. And last but not least, Olivia Ortiz. She's also a mother, community leader, and co-founder of the group Meta LLC. Olivia has been on the front lines sharing COVID-19 information, resources, and more recently, connecting with families about the misconceptions of the vaccine for children. Again, I'd like to start off, and I'd like to invite Dr. Chandramouli to ground us in the conversation and topic of today. Doctor, if you please come up.
Thank you, Omar, for that wonderful, kind introduction. And I would like to thank the School of Arts, and I definitely want to thank the Sí Se Puede Collective for doing this for us, and my very own Gardner Health Services for providing me the opportunity to come here and speak to you about something that's so important as the childhood vaccination for COVID for the 5 to 11-year-old age group. So, moving on to this, I would like to start out with the first slide, which is a very informative slide, which has a lot of data in that, and it also has a summary of the changes. But I would like to show you the main reason, I would like to have you all realize the reason why the vaccine is so important and the rationale behind it. The data shows that just for a 2-week period, we have had almost 8,300 cases and 100 deaths in children of that age. That itself is clear enough as to why the vaccine is so important. I don't think anyone in the audience wants their child or their loved one to be one of those statistics. I doubt that very much. And that is a leading cause for the vaccine. The FDA, the CDC, the ACIP are all leading authorities in vaccines. And they have conjointly approved this vaccine for this age group as an emergency authorization. And this is all based on scientific evidence. It's not based on just data alone, but it's based on scientific evidence as well. They have taken into account the benefits and the risks of these vaccines. Obviously, the benefits outweigh the risk of the actual COVID infection. Children, as you know, are probably the most active category in the human race, if I can say that. They are social, they're athletic, they're intelligent, they're uninhibited, and yet they depend on adults to provide that care for them. And based on that, I think it is our responsibility to provide that protection to the children of that age group. In turn, the children protect not only themselves, but they also protect their family, their loved ones, their friends, and the most valuable teachers that they come into contact every day during their school year. Next slide. This is a pretty self-explanatory slide. It just shows all the vaccines that are available in the United States currently. The only one that is available for children is the Pfizer vaccine. Pfizer is the only one that has been authorized, and it is still an emergency authorized vaccine. The full approval is still pending on this vaccine. I know there are lots of questions on the vaccine, when it'll be available for younger than 5. That is still in the works, and they are planning on having it down to the 3-year-olds and even as early as 6-month-old. That is still in the works, but nothing is set right now. The other vaccines will be approved. They are looking into approving the other vaccines for the same age group as well, but there is nothing official on those vaccines. At this point, we don't know what the future schedule is. I know we get a lot of questions asking when will the next booster be, how often do we need to get this COVID vaccine? Nobody knows that as yet. Everything is based on incoming data, and as you all know and you're seeing the news, data changes frequently. And based on that, they have to figure out what's going on with that. The next slide is changes, like I said, over time. They're still looking into different vaccines. They're looking into the pill for preventing of the seriousness of the disease. All that is still out there, but a lot of data needs to be substantial and and they're all based on data, they're all based on evidence, they're all based on scientific things. And of course, at this point, I would like to say that, mutant strains are already in the process of collecting data on those. And the thing that I would like to mention is, actually, this is the 4th. I'll go back to the previous slide. The other thing that I would like to point out is, I know everybody is now familiar with the Omicron that has come up now and is kind of trying to take over the Delta. The Delta is still the most prominent strain that is out there. The Omicron has hit in about 3 weeks or so now, and so far the data shows that it's still a mild infection with no hospitalizations. This just might go to show the effectiveness of the current vaccine. The current vaccine and the boosters definitely has some benefit added to the Omicron, and that's probably why it's still a mild disease. The other thing of interesting note is the fact that there has been data and studies to show that because of the fact that Omicron is definitely more contagious than the Delta variant, even though it's mild and has less serious disease, the spread is much more than the Delta variant, and that might serve along with the fact that more people are getting vaccinated and more people are getting the boosters. That might close the gap for the herd immunity. Everybody knows that magic herd immunity that we all need to achieve so that we can kind of have a normal life. And hopefully with that, it will help, and that's what they're looking into, and data is coming out on that. We also know that there is a 10-fold increase in COVID cases between the vaccinated and the unvaccinated people. The unvaccinated people have a 10-fold increase of getting the disease compared to the vaccinated people. That doesn't mean that the vaccinated people cannot get COVID. Yes, they can get COVID, but I would like to point out that it is definitely less serious. The morbidity is significantly less. The hospitalizations and death is significantly, dramatically reduced with the vaccinated population. The other thing that also comes up with pediatric vaccinations is the fact that can you co-administer the COVID vaccine with other vaccines? Most definitely, yes. Every pediatrician and every clinician that sees children must administer the COVID vaccine along with any other pediatric recommended vaccine. That either one should not be deferred. There is a whole reason why vaccines were developed. That's to prevent the disease. I remember the flu vaccine. People were asking, why do I need to get the flu vaccine? I get the flu anyway. I get the flu. The flu vaccine does not give the flu disease, and no vaccine gives you the disease. They give you side effects that are just an antibody response of your body, but the vaccines are developed to prevent you from getting the disease. It's not to give you the disease. So the next slide, I want to go over some of the myths that are out there. And some of the myths are kind of like, are the vaccines safe for children? It's most definitely safe. Multiple studies have been done with numerous children, and clear-cut evidence has shown that the vaccines are very safe and very effective in children. The next one, is it safer for them to get immunity by getting infected? That's always a very catch-22 situation. Yes, you do get passive immunity by getting the disease, and that's with almost any disease. But why would you want to get passive immunity when you can get active immunity by providing that vaccination to the child? That definitely has a much better gain to preventing COVID. The other thing is causing fertility. That has been in the news and the media as long as I can remember since the vaccine started out. Every single medical organization and authority have done research on this and have clearly found out that there is absolutely no evidence for that. CDC actually recommends anybody that is pregnant or wanting to get pregnant to get the COVID vaccine, because the risk of pregnancy outcomes with COVID is much more than the benefits of the vaccine itself. And then the other one is children are not, it's not worth it, it's harmed by COVID. COVID-19 is definitely valid for the 5 to 11-year-old. As I said before, the benefits completely outweigh the risk of getting it. One of the other things that I did not mention on this myth slide is I recently heard that one of the patients did not want to get the COVID vaccine because they heard that if you get the COVID vaccine, you cannot donate blood, ever. That is most definitely false. People can donate blood if you do get the COVID vaccine. And please don't defer getting the COVID vaccine because of that. And the other myths, of course, are like, not about the vaccine per se, but about the testing. People have started out the rumor that the COVID testing swabs are carcinogenic and cause cancer. There is no end to this myth. There is no end to that. And I would like to say myths are made by perceptions, by misinterpretations of things. But the facts are based on scientific data and evidence. Science is factual. And I think we need to believe in science before we move any further and get away from the myths and abolish the idea that these are causing infertility problems and that kind of stuff. The other thing that I would like to say is side effects. I don't think there is any vaccine that does not have side effects. If all of you remember, when you've had the flu every year, everybody gets flu-like symptoms, mild symptoms with the flu, but that didn't stop you from getting the flu vaccine every year. You still got it. I've had parents who refused to get the flu vaccine because they felt that they get the flu because of the vaccine. Again, the vaccine does not give you the flu. You probably were going to get it anyway, right? Yes, the COVID vaccine definitely has side effects. No question about it. We've all gone through that, myself included. We've gone through the side effects of that, but it definitely outweighs the benefits of the vaccine compared to what would happen if you actually got the disease. Now, we're not just talking about the acute infection with COVID. Remember, that's not what we're all trying to prevent. We're also trying to prevent the long haul of COVID, right? Once you get COVID, there is the long haul that you're going to have to deal with, right? And children are definitely prone to that too. So I want to make sure that that gets, clear with everybody that COVID vaccine, yes, that does have side effects, but the side effects are temporary, self-limited, and they go away. But the COVID vaccine, COVID infection, on the other hand, can be a permanent damage to you. And that is something that every parent has to think of when they are thinking about vaccinating their child. The other thing that I would like to point out is, I know everybody has heard about the myocarditis and the pericarditis, which is an inflammation of your heart lining. And that is definitely a rare occasion, a rare happening. It has happened after the second dose of the COVID vaccination in rare situations. But even with that, the risk, again, the benefits outweigh the risk of the vaccine, of the infection itself. And then, last but not least, I want to make sure we are around the holidays. We really need to keep people safe around the holidays. I want to make sure that, I don't think I can emphasize it anymore, vaccination is the safest way to end the pandemic. Vaccination is the safest way to protect your family, your friends, and your loved ones. Vaccination is the only way you can get to that magic herd immunity so that we can all get back to a normal life. And I hope it happens very soon. And at this point, I would like to thank again Omar and the Sí Se Puede Consulta and Gardner for providing me this opportunity, and all the audience for attending this. We'll be here to answer any questions afterwards. But please, 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 be safe and be healthy during the holidays. Thank you.
Thank you, Doctor. You mind going to the last slide, Doctor? There we go.
There we go.
All right, thank you, Doctor. Again, welcome everybody. Thank you for joining us in this panel. Wanted to make this conversation something that was very casual and something that you don't see a lot of, which was to be able to have the opportunity to have the doctor along with community health workers, and people that are doing the work on the grounds. Jackie, Olivia, for you to also have an opportunity to speak with the doctor and share some anecdotes, share some of those personal experience about what you're seeing on the grounds, maybe about some of the myths or some of the challenges that our community is facing. Because I think that when we have panels like this, or just conversations really about what we're seeing, I think it really helps us get to a better place and help other people that are still on the fence about getting themselves vaccinated, or in this case, their kids vaccinated. So with that, I just like to open it up for Jackie or Olivia to have a conversation again about what you're seeing on the grounds. Maybe you both have kids, and so would love to hear what made you decide to get your kids vaccinated, and if they're not, maybe what are some of those things that you're anxious about. And so with that, I'd like to open that up.
Thank you, Omar, and thank you, Dr. Chandramouli. I know for me personally, I have 2 daughters who are eligible for the vaccine, and I have not vaccinated them yet, but it's something that me and my husband are talking about And something that I heard that really encouraged me to start this conversation with my family was, my daughter's 10. So for her whole 10 years of life, I've always had and confided in her pediatric, her doctor, whenever I had a health concern, whenever there was question about, do I give her this medication? And so my idea was like, I don't have to make the decision alone. She has the expertise, she has the knowledge. I'm going to refer to her doctor and have those conversations with her, kind of like we're having with you today, and get my questions and my concerns asked. So for me, it's not no, I'm not getting her. I do want to get my daughters vaccinated. It's a conversation that we've had even with them, and they want to. It's making sure that we just have all the answers and everything's, all the questions, clear, so that we can, as a family, just feel comfortable making that decision. And I encourage everyone to do the same thing. Because like I said, like it's something we've relied, as even though my mom, Dr. Chandramouli, was my pediatric at Comfort Care Health Clinic. But whenever there was any concern, any type of, it's talk to your doctor. And so I think not to lose touch of that trust and that relationship that we have with our kids' doctors, and to really go and make a decision based off facts and medicine, because there's a lot of information out there. And I know Oli can go into that in our outreach that we've done in the community about, what we've heard on Facebook, or I saw this post, or I saw this news station. I know one of the biggest things that we've heard, and I think Dr. Chandramouli covered it, but maybe can go into it a little bit more. But the idea of like, if you get the vaccine, you're going to be sterile. You're not going to have kids when you grow up. We've heard that a lot. Mm-hmm. As well as, like, oh, but, the COVID doesn't affect our kids. It affects elderly people, so why do I need to vaccinate them? I don't know, Dr. Chandramouli, if you want to go on that topic a little more, but I know it's something that we've heard a lot.
Yes. As far as the fertility problem, yes. That has been one of the hot topics that has happened for a long time. And I know as soon as that happened, I know even the American College of OBGYN issued a statement. The American Academy of Pediatrics issued a statement. The CDC also issued a statement because of that, and because to overcome the fears of people who were thinking on the same lines. And it's not just with the little girls or teenagers that they were concerned about. They were concerned about young adults getting the vaccine and possible infertility problems with that. But that has definitely been resolved, I hope, to say that that is definitely not the case. In fact, CDC actually issued a statement that they recommend the vaccine for anybody that is pregnant or wanting to get pregnant. They issued a statement not too long ago, right? And CDC, when they issue a statement like that, it is based on evidence. It is based on data. It is based on evidence. So, I mean, yes, if you look at Google, you're going to find so much information. I mean, Dr. Google has a lot of work, right? But if we start believing everything Dr. Google puts out, then there is no end to that. There is no end to that. I think we all have to kind of take a step back and say, what is reality? What is fact? Then we need to think go back, take it a further step and say, here we are questioning COVID vaccine, right? Are we questioning every single vaccine that has already been out there? Are we questioning every single medicine that we are taking? Are we questioning every single agent that we're using now for swabs or whatever? No, we're not. I think we need to be practical about things. We need to be realistic about things and see where do you draw the line between reality and fiction and, myth, right? I think it's very important that we do that, because otherwise you're going to be caught in a web and you're not going to get out of it.
Yes, thank you, Doctor. I think one of the things that I'm, from Jackie, which you just mentioned, and Doctor, which I think you're covering again, it's this idea of getting informed, right? And again, this is why we're having this. This is why we feel this is important to have at the community level, and be able to talk to you, Doctor, talk to, people that are doing the work on the grounds, and not to believe, us or the doctor or the panelists in general, but get informed, right? And a lot of people are getting their information, like you just mentioned, through Google or through any, online source without having to check it, right? And so I think that if there's a message here is really about getting informed, right? And going to those trusted sources
Exactly.
that are, your trusted sources,
Yep.
right? Not our trusted sources, but your own trusted sources, which is
Right.
your doctors, right? And other people that you trust to give you the right information. So, Olivia, you also have kids. Can you maybe share a little bit about, your own experience?
Yes, I have a 14-year-old and a 10-year-old.
14 and
14 and 10, yeah. My
10.
10-year-old just got his second shot on last Friday. He was perfectly fine. But since the beginning, we started, yes. He was ready for it too. He was so ready. But so we started talking to my husband about it, and we were like, I actually wanted it so bad to come up with the vaccine for him because he started went back to school. There was more, he's very social, so he's not gonna, just not hug the friend or anything. I knew so I was very worried about that too. So that wasn't the reason. But someone asked me, why did you got him vaccinated? And I was like, well, a job as a parent, we have to protect our kids.
Exactly.
Right, so and my job is to protect my kids
Exactly.
no matter what, and I have to protect them from COVID.
Right.
Because it's real, it's out
It
there.
is real. Right.
And the reason that we did is because of that. I don't want to, I want to protect my son and my daughter, my kids. But when I'm talking to people out there, one of the things that as Jackie mentioned, is like they listen to so many myths out there. And I told the same thing, ask your doctor, ask your kid's doctor, Even if you have questions to say, go to there's vaccine sites where there's nurses, there's doctors, you can ask them, right? I cannot tell you like, oh, because I don't know your kid, someone that knows your kid, your health, it's the doctor, you should go with it. Do not pay attention to YouTube, because every time, where do you find that information, right? Oh, I saw that on YouTube. I was like, no. Right. Wrong source. So if that's my advice, right?
Right.
Get informed. If you have any concerns, you have any questions, you can even search the research online, right? But one of the reasons they asked me, how do I know what's in the vaccine? Like, how was it made? You can research it, right?
You can research it, and like you said, do people actually research every single vaccine, every single medication that's out there? Come on. Nobody does that. Nobody does that unless you're a researcher or a scientist, right? So all of a sudden, COVID vaccine has become such a huge research thing, right? And I think it's getting carried out a little too, people need to trust the right sources. They need to trust the medical authorities to say, hey, yes, this vaccine is safe, right? Right? But unfortunately, there are a section of people that want to do the research and want to get into the delve of all the ingredients, but do they really know what ingredients they're consuming every day? And what harm that does?
There's also
don't.
something that also I get a lot from parents is like, if the kids don't get that many symptoms and COVID doesn't affect them as an adult, why should I get them vaccinated? Because they got the information that a kid does, which is true, they don't get as some of them, right? Not as bad as an adult, but they're asking me, what would I vaccinate if COVID is not going to do the big of a harm to them? And I'm like, well, that's not true.
That's not true at all. Like I said, we've seen so many deaths, we've seen so many, hospitalizations with children. So children are definitely affected by COVID as much as adults. And my main thing is, I'm a parent, I'm a grandparent too, and I can't wait for my grandson to turn 5 to get the vaccine. But my thing is, as a parent, my first instinct is to protect the child. That's my first instinct. That's it. Case closed almost, right? There's nothing else that's more important than protecting your child.
And I think that's most of our parents, that we do have that instinct, right? But some of them don't have the right information.
Right.
So I kind of understand them. I mean, I've been working since when everything started, right? I've been working around COVID. I've been going to trainings. I've been a lot getting information, which I know that I have the information, but there's parents out there that don't have the right information. So what I encourage them to go look for the right information, but go to a very trusted source. Don't go somewhere where you don't. So just like Jackie said, go to your doctor. But there's people out there that I know that they don't have that information that I have or that we have. But it is out there. Just please go look for it.
Go look for the right information.
Yeah.
Yeah. Don't just do a Dr. Google search.
That's a new one, Dr.
Dr.
Chandramouli.
Google search.
Dr.
Yeah.
Google search. Thank you, ladies. Personally, I have a 13-year-old and an 8-year-old who just got the vaccine. He's scheduled for his second dose next week. And interestingly enough, my little one was like, "Hey, why can't I get it?" Right? Like when my oldest got it, and so he just couldn't wait, right? And I think it was that type of reaction, and I think that type of anxiety to just go out and get it, like came from the discussions that we were having as family, right? And being able to trust the doctors and having discussions. And so, in general, just inviting everybody to go to a trusted source to get informed. And again, that is one of the reasons why we wanted to get in this conversation, right? To be able to, people that are seeing the work on the grounds,
Right.
doctor, not that you're not on the grounds, but I think there's a level of, mistrust somebody, right? Or mistrust that, is not, their own doctor, right? But in general, again, trusting the science, trusting
Yeah.
the professionals is always important. And so with that in mind, we'd like to open it up for if anybody has a questions, either here in the audience or on our Facebook or a Zoom. We'd like to open it up.
So our online attendee, Guadalupe P. asks, when the doctor stated the vaccine doesn't give you the disease, it prevents you from the disease. Does this mean that if you get the vaccine, it doesn't give you COVID? Rather, it prevents you from going to the hospital?
Let's see. I think I'm hearing two questions there, but if I'm understanding correctly, I think, Doctor, you stated that, so the question is, or the way we understand the question from the Zoom call is that you mentioned that when you're getting the shot, you're not getting, a dose of the actual disease, right? Can you maybe share from a medical perspective,
Right.
What is in the shot, or, and maybe go into that a little bit?
The vaccine, what it does, it creates antibodies in your body. So that helps you to prevent you from getting the infection. That's the disease, right? The vaccine itself doesn't cause COVID disease, right? So that's the difference, right? But the misconception has always been, particularly with the flu vaccine, or even with the COVID vaccine, that it causes the disease. It so happens that the ones that did get the COVID infection soon after they got the COVID vaccine were more likely a coincidence rather than the vaccine causing the disease. They were probably going to get the infection anyway. They were already incubating that infection, and they would have gotten it, and it so happened that they got the vaccination. And in people's mind, they're thinking, oh, the vaccination caused the disease, which is not true.
Would you say that it's a fair statement that what's in the vaccine are mainly, you get the symptoms, but you're not getting the infection? Right. Am I understanding that correctly?
Right. The vaccine simulates the disease. It simulates the symptoms of the thing, so that's what creates the antibody response in your body. So you don't get the actual disease.
Simulation, I think, is a key word.
Yeah.
Any other questions from our audience, from Facebook or our Zoom?
Yeah, we have one question. So what kind of allergic reactions have children had within the last, within the first 2 days? Because we've seen, adults having reactions, or does it differ, or how severe is it? Is it, just that general question?
So if I understand the question correctly is there any difference between the adult vaccine and the reactions, whether allergic or otherwise? Is there a similar for kids, or are we seeing a difference, doctor?
The side effects between children and adults, it's pretty similar. The side effects are all pretty similar. They have the same type of side effects. The variation is so variable. It's difficult to predict who is going to get a worse side effect. Is it the child or the adult? Because they both had similar side effects, and I don't think there's been any data to show a significant difference between the side effects.
Great, thank you, doctor.
Yeah.
Any other questions from audience or from our Zoom or Facebook Live? Go ahead.
Hi, good evening. My name is Veronica, and I'm a community navigator here at the School of Arts and Culture. And I guess my question is kind of based around how do you, each of you see that we can help rebuild that trust, or because I think that came up in a lot of what you were saying, is that, and I think it's true of the kind of the cultural and political climate that we're in right now, is that a lot of people don't trust what's in the media, or they don't trust what medical authorities are saying, or there's this kind of, it's like a societal thing that's happening right now. So that's one part of my question. And then maybe on the other side of that is also, how do you see us being able to help bridge the inequities that are also happening in our communities as it relates to public health?
All right, I'm going to try to capture those two questions. So the first part is, how can we, or what can we do either as representatives of our community and the work that we're doing personally from a marketing and outreach on the grounds, with COVID response outreach, doctor, through your lens, is how do we gain that trust of our own community members, of our, in the work that we're doing? Olivia, looks like.
Yeah.
I think spaces like this, right, where people can learn more, where there's the experts, available, where people have questions, they have, doubts about it, where they can, reach out to, right, and actually listen to more people, listening to kids, how did it went. I took my vaccine, how did it go, how you feel, but I feel like spaces like this is also very important for the community.
Yeah.
Great. Doctor, you have a
Yeah,
answer
I think
for that?
it's just constant education. I think that's very important. And I think people need to realize that, yes, the media is changing its tone, and yes, the media says one thing one day, another thing another day, and all that stuff, but we need to kind of educate the people and say, there is a reason behind that. COVID is new. COVID has just been around for what, a couple of years now? And everybody is learning about COVID. Everybody is learning about the vaccination. Things are changing. Look when we started out, we didn't have Delta. We just had a couple of strains, and then Delta comes up, and then now it's Omicron, and then God knows what will happen the next, right? Strains are happening. And so people are researching all that stuff, so they also have scientific data to include with all the information, right? And that's why the news media also is changing their, game plan, and guidelines are changing based on new advances and new development in the strain or the disease. And people need to be educated that that's why those things are happening. It's not because there's an underlying mistrust or anything like that, right? The reason that is happening is because it's true, it's real change that's happening, right? Nobody knew about Omicron like 3 weeks ago, right?
Yeah, so if I'm hearing you correctly, and if I'm hearing Olivia, doctor, again, we go back to getting informed and speaking to others and having this type of dialogue. I mean, it doesn't have to be a formal per se, right? But having conversations with your family and staying informed. And also, you just mentioned something which is, this is still relatively new, right? Things are changing, and we're trying to adapt, right? And so the one thing that we can do, you know, on a personal level, is to stay informed, right? And that's why the work that we're doing, having this conversation, that the work that you ladies are doing on the grounds is so important, because it's still so new, right? And people, it's okay to question things. It's okay to have doubts, right?
Right.
And it's okay to wait, you know, for your turn. Jackie, do you want to add something?
Yeah, I want to add on, and then I also addressing like the other question about like equity, and like what we can do as community. I say servants because we're serving our community, and you know, whether you're the county or the city, I think something that has really worked is meeting people in community where they're at. Really early on with COVID, COVID testing wasn't as accessible as it should have been right off the bat, right? And even when it did become more accessible, you know, we had community, especially in San Jose, who couldn't make it to those sites. They didn't have a car. They had a lot of kids. You know, something was always going on. And so I remember when me and Olivia were able to be part of the door-to-door testing and actually going door-to-door with their carts, testing people in their home. And sometimes people were like, no, I'm not getting tested. But then they would see us again. And then, you know, okay, you know, this time I will. So it was like that constant, you know, we're here to, you know, provide the service. We're here to provide the information. We're not here to like convince or persuade anyone to do anything they don't want to, but it's here if you need us. And I think that was really something that community appreciated. They recognized us after. We had butterfly shirts, so they were like, the ladies with the butterflies. But that was, you know, that service of meeting community at their home. Okay, you can't come to testing, we're gonna take it to you. And then after, you know, the pop-ups started popping up more closer to community, people could just walk. We're at Story Road now, right in the middle of, you know, Tropicana, where it's a lot of shopping centers and a lot of houses, and people say, I didn't even know you were here. I passed by, I was getting groceries, you know, I'm gonna walk in and get tested. And I think that's the same thing with the vaccine, right? If people are not getting the information because they don't have access to our Facebook, to our newsletters, maybe they don't have TV, so they don't have the channels, then we need to go out and meet them where they are. And so that's, I think, important of the work that promotoras are doing, going and knocking on doors, going to community events, food distributions, and just saying, you know what, like, here are the facts, here's the information. We're not gonna persuade, we're not here, our job is not to force anyone to do something, but we wanna provide the information and that conversation, you know, like if you wanna have a conversation, you know, about whether you don't wanna get it or you do wanna get it, that's what we're here for.
Thank you. Doctor, did you want to add?
Yeah,
to that?
the only thing I want to add to all this health disparity and inequity or whatever, my thing is, this is a public health hazard right now, right? Everybody has a role to play in this, how they're going to prevent this from affecting the next person. It's not about you anymore. It's not about you, it's not about you. It's about the next person and the next person. It's a public effect, right? So I think that's what we need to educate people on. This is no longer a freedom, no longer a right issue, it's no longer any of that stuff. It's a question of a public health. It boils down to that. And I think that's where we have to educate people on. It's not about you.
Yeah, one thing that I think about, and as a contrast, I've traveled to Mexico and I have family in Mexico, and you know, to continue the conversation about health inequity and what that means, I've had conversations with family members who, you know, I've mentioned like, oh yeah, I just got tested last week, and I'm going to get tested again tomorrow. And I got, I got tested two months ago after right? And they're like, wait a minute, is it free? And I'm like, yeah, like it's free everywhere, right? And so then I hear the conversation about like, well, if we want to get tested because we think we got exposed or because, we got to go into work, they have to pay for it themselves. And so I think that's a big contrast maybe that we see here in the U.S. that, that we don't have that reminder of, countries just south of the border, who don't have access to even get tested. And so you can imagine, getting treatment for COVID and all of that. And so I think, thank you for that question, because I think that's very important, again, not just here in the U.S., but in contrast with other countries that are, so close to us and kind of what we're seeing. And I think, government, for what it's worth, city, county, are doing their part to be able to allow some of the work that we're doing at a community level. And I think that's been key, that's been important. Again, I can't really think of another outlet or of another topic where that has been the case, where, again, government and community really get together to carry that message. And not just the message, but, some of the solutions, right, that are there for our communities to make it easily accessible. Like you mentioned, Jackie, being able to walk through a vaccination site or a drive-through. I've been able to go through, a few drive-through, sites, and I'm like, yeah, like it makes it just so easy, for us to do that. Even with my kids, because we're seeing exposure, at school, the school district has made it really easy, to go get tested and get results within, literally within a day, so that it keeps our kids, in school, and on to, to their education, right? And so with that, just want to, bring us kind of back. We have about 10 minutes, and we want to make sure maybe if there's any other questions from here, the audience, or through our Facebook Live, or the Zoom. Go ahead.
Yeah, we have a question from a viewer tuning in virtually. I guess pertains to all four of you, a little bit more personal anecdote. What gives you hope about your community and public health work just to keep continuing on, with Omicron now coming out? Who knows if a new variant's going to come out? How do you keep that drive going? And what do you recommend for people who want to join in your outreach?
Got it. So if I'm just gonna try to paraphrase there. So the question is, for us four, that are doing the work as a doctor, as a community health worker, a mother, how do we keep doing this and not get tired and not get into where we don't want to do this, right? What keeps us going what keeps us going in order to be able to carry that message, not just this last 2 years, but moving forward? I'd like to open that up for.
Well, on a personal note for me, this just goes back to why I became a clinician, period, right? I became a clinician to serve the people, and I particularly chose to work in a community health center, right? For the very reason that those are the people that need the help, and the reward and the sacrifice and the satisfaction you get is priceless, right? So that's not going to change whether it's COVID or whether it's Omicron or whether it's something else that's coming down the pipeline. That's not going to change, right? You just keep going as long as you can keep going.
Thank you, Doctor. Olivia?
I've been living in this community for about 30 years, and I've experienced a lack of resources here in our community. Since COVID started, we all knew what the barriers were. We all knew what, trusted, language barriers, immigrant family not having that. So what made us being out there and do our job is because we want to break those barriers down. We're going to take them down, right? We want to go to the people that they don't want to go to a place because they don't speak the language, right? We want to go get to someone that that maybe, like Jackie said, right, doesn't have a car, so doesn't go there. So that gets me going, knowing that we are doing our part to reach out to those people, to those community, and give them the resources that they need, and give them make it easier for them to get vaccinated, to get tested, because our community were the one that got hit the most, and that's because of the lack of resources. So from the starting, we start going, and seeing that person that saying, you know what, oh, thank you so much because I got tested, I find out that I was positive, or else I would go and maybe be exposed to my family or something. So when I hear that, and that's what keeps me going, right?
Yeah, because you're making a change even in that person that you talk to, even if it's one family, that you might have prevented somebody from dying. Jackie, does your baby want to add something to that? I think.
Yeah. Sorry, I'm just I'm pregnant, so I'm a little bit emotional. But that, thinking about, Olivia said, the very first months when COVID and we went into shutdown, I feel like there was this gut, feeling like something, it was going to impact our community. We didn't know why, but I just knew. We knew it's going to have a huge impact here in this community. And so I think it really came down to that decision. We could have stayed home. To be realistic, a lot of people had the privilege to stay home and let COVID do what it did in our community, or we can go out there and provide our services. And everyone had, I don't have to have a degree to have a service, and just try to help as much as we could. And this was even, before the collective, so we didn't know how to help, but we were, volunteering at food distributions, diaper distributions, wherever we could. We just knew that people were suffering, and that's our community. We live right here. I live down the street, and so you can't really ignore it because you're going through it. Your neighbor just passed away. People from your daughter's school, are going through it, don't have food because they're not working. They're immigrants. They didn't qualify for, the stimulus or, unemployment. So there was no turning a blind eye to it. And we chose, I think, a lot of us, and it was really great to see community come together to really just help as much as we can. And I really do think at the end of the day, because of that, and a lot of the ladies and a lot of the volunteers and people who put in that extra work, that we saved lives. We lost a lot of lives, and it's really hard to even look back and think about the number of lives we lost, but I also want to think that we saved lives as well.
Thank you, Jackie, for reminding us that family and our closest community, and the most affected is you and colleagues were able to step up and fill that void, and knowing, like you mentioned, that the privilege of those that can stay at home, that we're able to stay home. And so we thank you for that service. Just doing a time check, we have about 4 minutes, and I think, Doctor, just want to end with a question that we had submitted prior to this conversation. And I'll generalize, but I think it'll cover the question. And the question is about, for those kids that are their health is at risk because of a prior condition, what is there can be so many, right? So many issues with health within kids. But in general, what are you seeing is the message for those parents that have kids with a precondition? I know that it's hard to pinpoint, for one type of sickness or another, but what do you think is the general message that is being
In general, I don't believe there is any contraindication to the COVID vaccine to anyone, adults or children. There are very, very few contraindications. And children with underlying health conditions, the same as with adults with underlying health condition should get the vaccination, because that's going to help them overcome some of the disabilities or the disadvantages they're going to have if they get the infection. So that's the message that should go out, that everybody should be recommended. Yes, there are maybe some conditions that they might need to defer the vaccine, not necessarily not get the vaccine at all, but that would definitely be a conversation they need to have with their own private doctor on that.
Great.
But basically, there is no condition that should deter them from getting the vaccination.
Great. So if I hear correctly, the message is then to obviously, speak to, your own doctor to be able to give you the best information because they know your kid's best.
Right.
But in general, you mentioned that, people should still get vaccinated because they'll be better protected.
Correct.
All right. With that in mind, we do have about a minute left, and so I'd like to maybe open it for one last comment from each of you. But before that, I do want to thank you, Dr. Chandramouli, for joining us in this conversation.
Thank you.
Because I think, again, it's important. And then Olivia, thank you, gracias. Jackie, for joining us. I think it's even being able to just have this discussion. I come from a marketing and outreach and have been doing some of the work on that level. But to be able to have this opportunity to hear from you and just share some personal anecdotes about, the work that you've done, which has been so important for our community, and will continue to be that, because we're still, we're still in the middle of it, and we're still in the thick of it, and we're still got to carry our message strong. But any last thoughts?
Yeah. The only thing I would like to say is we've proven that COVID vaccination is effective. We have proven that the number of cases have gone down since the advent of the vaccination. Children, as far as children go, they are the future of our country. And we need to do everything we can to protect them in every possible way. And COVID vaccination happens to be one of them. And we need to do everything we can to promote that and to vaccinate all eligible children.
Thank you, Doctor. Olivia?
Well, I just want to go with get your kids vaccinated, do the research, ask questions. We're doing our part of giving that information out there. We're doing our part to doing the outreach. We work, to get sites here closer to people, have like more access to the vaccine. It's out there, it's easy to get to a clinic or a pop-out site. It's really close. But yeah, like the doctor said, just protect our kids, they're our future. But do the research. We're here, we are trying our best so the vaccine can get to the kids, and because it's gonna take all of us to get out of this mess.
Yes,
right?
it is. Jackie?
Yeah, I think I just want to end it with saying, I think if we're ever going to get to that space where we start talking about recovery, because like Olivia mentioned, way before COVID, our children were already up against a lot in these communities, our families in general, and housing, education, and so they need a lot. A lot of kids have gone through a lot. I want to talk to my school, about therapy, about other stuff, but we can't even get there because they're still testing kids positive in school, and a lot of people are still not vaccinated, and so we can't get to that recovery and that moving forward from this pandemic until we get past these cases.
All right, well, with that, thank you again, Doctor. Gracias, Olivia, Jackie, thank you. And thanks, everyone, for tuning in and joining us. I'd like to thank everybody behind the scenes. You see us up here, the four of us up here, but there's a lot more people behind the cameras and behind making this happen. The Sí Se Puede Collective, School of Arts and Culture at Mexican Heritage Plaza. Again, thank you for tuning in. I think the constant message up here was about getting informed, all right, and trusting and going to those trusted sources. So with that, we'd like to thank you, and be safe, everyone. And when you think that you're ready for your kids to get vaccinated, as you heard from everybody here, highly encourage that. And again, thanks to everyone for tuning in, and we hope that you can keep communities safe.